So fourth quadrant, in the posterior area, point fulcrum where your fulcrum position is. Point the tip interproximally in between the teeth, and your terminal shank should be parallel to the long axis of the tooth. With the wrong end, if you did the same activity interproximally with the tip, your terminal shank is on a diagonal to the tooth. It's the wrong end.
Okay.
Okay? Okay. So when we're using this instrument, in the posteriors, we'll start with the posterior tooth. You're going to insert the tip at the distal line angle. Okay. You want to go to the bottom of the pocket. Okay. Assuming this is a 2-3 millimeter pocket. And then you're going to want to make wrist motion activation, vertical strokes interproximally. You want to go to the midline of the tooth in between the teeth, and then work your way up underneath the contact, and then around the contact to the top of the tooth. So it's short, overlapping, vertical strokes interproximally. Then you're going to turn your instrument so that you're using the other side of the toe, of the side of the tip rather. Insert at the line angle. You might have to go a little bit of a diagonal so you can insert basically at the corner of the papilla, and then oblique strokes on the facial. Again, using wrist activation, we'll have to work on that on specific areas. Coming around to the mesial line angle of the tooth, staying at the bottom of the pocket all the way. Go to the midline of the tooth, and then work your way up under the contact, and then facial to the contact. That's how to explore a posterior. So the fourth quadrant buccal posteriors, 8 o'clock position, 8:30. Head is straight, mirror fulcrum on the first quadrant anterior facial area, somewhere in there. And your instrument fulcrum is around the fourth quadrant, again on the incisal occlusal surface. And you'll notice when you have your hand in the mouth that your hand is going to be right close to the top teeth, if not touching. Okay, so inserting at the distal line angle, vertical motion activation with the wrist, up and down, up and down, up and down to the contact, and then around the contact and out. Turn the tip, reinsert at the distal line angle using the other side now. Oblique strokes, oblique, oblique, oblique. And rotate and pivot, turn and go in between to the contact, midline, and then all the way to the contact and then around.